Hello and good morning. I am Dr. Rachna Singh, Consultant Obs and Gynae at CK Birla Hospital for Women. Today I will be talking to you about an issue which we face in our daily lives. It is dysmenorrhea or the painful periods. In the medical term, dysmenorrhea basically describes the pain which we feel during the periods. This pain can be mild or it can sometimes be so debilitating it affects your daily activities of life. Dysmenorrhea is something which starts maybe from day 1 of the periods and it can continue till the periods finish and disappears on its own. Usually dysmenorrhea is usually divided into two conditions. It could be primary dysmenorrhea or secondary dysmenorrhea. Primary dysmenorrhea is a very natural thing to happen. This happens because of the uterus shedding the endometrium and releasing enzymes called prostaglandins. These prostaglandins cause the uterus to contract and that gives the pain. It is a very natural process because these are the natural enzymes which get released. Hence, the management of primary dysmenorrhea also is very easy. Secondary dysmenorrhea is the one which happens because of certain other pathologies and elements going on in the pelvis. It could be a fibroid which is growth of the uterus, it could be ovarian cyst, it could be infections in the pelvis or maybe a sexually transmitted disease, it could be adenomyosis or endometriosis. Depending on what the pathology is, we plan for the treatment. Treatment for primary dysmenorrhea is, it could be your changes in the daily life like exercise, taking care of your diet, avoiding any sort of stress, and painkillers can always be prescribed. Local therapies like hot water bottle or maybe rubbing really helps with primary dysmenorrhea. If we find there is a pathology, then that needs to be managed depending on what it is. Other than medical management, which is medicines, which could be painkiller, it could be oral contraceptive pills which help in regularization of the cycle. We can insert the IUCD which are hormone laden and they reduce the incidence of these release of the pain enzymes. If there is a tumor or a cyst, that might just need removal to give you pain free periods. Depending on actually what the pathology is, we need to address the problem of dysmenorrhea. So, other than medical and non-medical management and maybe the surgical interventions, I hope you found this small item on dysmenorrhea helpful and maybe a small guidance towards how to manage and when to visit your gynecologist if you are suffering from it. Thank you.